So far, at least 81 countries have reported cases. 95,000 people or more have been infected worldwide, and at least 3,200 of them have died.
Late on Sunday night, the mayor of New York tweeted that nightclubs, cinemas, theatres and concert venues in the city must close.
We came together in the beginning of the pandemic to address what was it that we needed to do. It was clear that we were not going to close our doors. It was clear that we were going to continue to respond to the need of the communities and making appointments and seeing clients. But we also needed to take care of the well-being of the agency, the well-being of the staff.
In an ever so changing environment and community, it's really important to provide services and kind of meet community there.
Having a place to call to be able to continue to come here when everything else outside was crumbling or starting to shut down.
If in fact people were going to be sexually active, that they needed a place to go to make sure they were taking care of themselves.
I still want to be active. I still want to be connecting with my partners or connecting with, with someone that they've met. How do I do that safely? And then I will navigate them to that process.
We decided to continue to show up for our community, for our clients, meaning that we kept appointments open, we kept clients coming in.
We had a staff that was willing to morph to any type of situation, and we adapted. We adapted really well.
What was so important for me when this started and when we had to decide whether we were going to stay open or be closed was really recognizing the role that sexuality plays for people in reducing isolation and having connection and feeling whole, and recognizing that if people were going to stop sexual activity, it was not going to be sustainable. That sex was something and connection was something that people really need and really want.
The older generation that I have talked to, in many ways, they're seeing this trauma again, especially those who have gone through the HIV/AIDS epidemic. A lot of this is about who we interact with, how do we interact with, how do we find each other's status, what can we do to mitigate any type of contraction of the virus.
Some of the things that continually brings me back to testing is the fact that our clients affirm every tester or every counselor here, the fact that they are thankful for this service and also that this is helping them reduce their stress during a time that there's emotional, physical, economic turmoil.
Gay City is an institution of hope, is a beacon of light where we can actually, in the midst of what is going on out there nowadays, we can say, come to us, come here, you're welcome, you're okay here. We see you as part of the community, as part of us, and we are part of you. So keeping this agency and services alive, thriving, and continued is more critical than ever.
What COVID has done is it's really wiped out a lot of the traditional sources that we've gone to for funding for these services. And so making an investment in the work that we do, telling us by contributing to Gay City and whatever amount, it may be that you have, I think COVID has hit all of us hard, right? So not everybody has the resources they might have had in the past to contribute to organizations, but whatever amount, small or large, that you can invest in Gay City at this time is particularly valuable and particularly important as we continue this important work.
The communion of the other agencies that we work with have solidified much more throughout the pandemic, giving our clients faster solutions to attaining well-being, treatment, and or any form of counseling that they need.
Here we are, 8-9 months later, in the midst of everything that has been going on in this country. And when you look back, we were able to say we did the right choice. We did what was good for our agency, for our staffing, and also most importantly, for the clients that do come here.